One of the nice things about Health Pavilion North is that we can provide just about everything that a patient will need during his or her treatments with either chemotherapy or radiation therapy.
We have full service for oncology, and I do that here with several dedicated personnel, big staff dedicated to taking care of the patients here. We have full service of chemotherapy, biological therapy. The clinic has radiation therapy, and that's been wonderful right here on site.
Dr. Fink, who's the medical oncologist here, and I collaborate very closely, and that's very important for cancer patients. These days, many, if not most of our patients get what we call combined modality treatment, which is a combination of chemotherapy and radiation therapy.
I think it's the best way to do oncology, is to have everything available at one site where patients can come and not have to go through a lot of trouble to find where else to go. It's all right here. That's how you make cancer go away. Patients don't have that, they don't show up for their treatment. They have to have a place that's comfortable and that's comprehensive.
One of the main benefits is for people living on the north side of Fayetteville and many communities in Harnett County. And in fact, we get patients from Spring Lake, we get patients from Sampson County even. We provide a much more convenient location to come and receive essentially comprehensive cancer treatment.
There's a feeling when you walk through that we all really like what we do.
For me, it's a privilege. I don't know that anybody has the opportunities that I do on a daily basis. I see people at their best. I see people at their worst. They're the most scared they've ever been, the most happy they've ever been sometimes with the news.
One of the things I do enjoy is when patients are pleasantly surprised at what we can offer them in terms of treatment, and they often come in, frightened and anxious about their diagnosis. A lot of times it's just not knowing the information that they need to know that contributes to the anxiety. And of course, hearing the word cancer is very frightening by itself. But after I spend some time with them and we talk about the diagnosis, we talk about some of the treatment options and what some of our outcomes might be, and they are often much happier leaving, and they are pleasantly surprised that perhaps it is not necessarily all as bad as they thought it would be.
Spending the extra time with them, that's really what I enjoy the most. If I can get the extra time just to get to know a person better, get them to know me a little bit better, get them to understand what we're embarking on, the treatment goes better and the outcomes are better.
I think one of the greatest things we have to offer is, one, the size of this facility for one, because it is so small. And I think that during this time that people need the intimacy that I think can be provided here. I literally can look over when phone numbers come up on my caller ID and know who it is. And that's nice when you can even answer the phone and say to the person, hey, Mr. Smith, I know, what's going on. I know you called me yesterday and I asked you to call me back, so what's changed? Because again, it's small. The phlebotomist knows what a patient, she can bring the patient back to me and say, they're really not doing too well today. She says she's doing okay, but I just know that's not her.
You get a connection with the patients, and they're more to me than just patients. They're like family.
And sometimes they want to talk, and sometimes they don't want to talk, and we've learned when to talk and when to listen.
The heart of this for me is when I have a patient before me, there are so many things I can't change. I can't change a diagnosis, I can't change a scan, but I can change the experience for that moment, and that's what it is for me.
We are treating patients at the highest level of care in oncology. We have access to trials and to drugs that are on the cutting edge. So I really feel real secure that we're doing things at the top level possible.
I can't imagine it being any better anywhere else. I really can't. And if it were, I would want to know about it so we could be that much better.
It's very common for patients to say at the end of their treatment, I'm going to miss coming here. I mean, and I can't believe I'm saying it. I'm done with my radiation treatments. I'm actually going to miss coming here because I like the people. I like the interaction with the staff, everybody from the front desk on to all the providers. They just really appreciate the care that's shown here. I love what I do. I wouldn't do anything different.